Okay, we're live, Cari. Hello, everybody. Welcome, welcome, welcome. Tonight, I have something extra special for you. Tonight, our guest is Cari Maxwell, PKD patient, kidney advocate, NKF Celeste Castillo Patient Engagement Award winner. Wow. So, let's talk about our friend Cari. PKD runs in her family, as her father, Conrad Nasatka, suffered from it, doing dialysis 3 times a week until transplanted in 1987, giving her family an extra 31 years with him. Nonetheless, he faced many challenges with PKD. This played a very important role in Cari's life. Quote, "It was his brave fight and positive example to me that has fueled my passion for speaking up about kidney disease and the needs and rights of patients. It is my hope that in some small way, my efforts honor his memory," unquote. In 1988, Cari was first diagnosed with polycystic kidney disease at the age of 10 by diagnostic imaging. Her parents did not disclose this to her until she was 18 years of age. By the time Cari had reached 30, her PKD symptoms began to show in blood pressure checks, and a nephrologist took a very reactive approach. Doing her own research, she discovered a clinical trial for Talvaptin, and despite travel challenges, and they were substantial, by the way, she completed the trial for the first FDA-approved treatment for PKD. She has helped to bring positive effects of this medication to the PKD community. She has some very strong feelings about clinical trials being more accessible and inclusive and keeping the patient's voice front and center. Cari has openly discussed the issue of becoming a mother with PKD and possibly passing the disease along to her children, a concern that almost every PKD parent has. What makes Cari exceptional has been her ability to channel all those emotions into something positive and set the best example for her girls by taking charge of her own health, being open to research, and sharing her story with others. Cari is a very active kidney PKD advocate. She is a member of the National Kidney Foundation Advocacy Committee. She's also very active with the PKD Foundation. As a result of her efforts at the NKF Spring Clinical Meetings in March of this year, she was awarded the Celeste Lee Patient Engagement Award. This is the highest honor given to a distinguished kidney patient who exemplifies the foundation mission and represents the legacy of patients who have worked tirelessly as advocates for others in the kidney community. Quote, "It is truly humbling to be recognized among the other fantastic advocates who have received this award. It validates our collective hard work and dedication to those living with kidney disease, their caregivers, and those we've lost to kidney disease. I'm grateful to the NKF for providing the platform and the opportunity to get involved in the kidney disease community and to meet the wonderful advocates, physicians, scientists, and other stakeholders who, like me, are working toward a common goal. Please give a warm welcome to our friend, the great Cari Maxwell is here tonight. Cari, how are you?
Well, after a welcome like that, I'm great. Thanks, Uncle Jim.
Oh, you're welcome. Tell me, did I state everything correctly in the introduction?
You did.
Good. Please tell us a little bit about where you grew up, your education, your employment history.
Yeah, absolutely. So my family is from central Pennsylvania, but I grew up mostly in the Wheeling, West Virginia area. So just about 45 minutes south of Pittsburgh, if you don't know where Wheeling is. That move ended up being a very critical later in my story and in my father's story, as it allowed us to be very close to where his almost perfect matching kidney was located. Wanting to be closer to my family, I moved back to the Lancaster, Pennsylvania area, so kind of near Hershey, if you know where that is, about 90 minutes outside of Philadelphia. I have worked for the last 9 years at a technology firm in various director capacities. I have a heart for people's connection to what they do professionally. So my most recent role has been as the director of culture and operations. I live now currently just in Lancaster County, Pennsylvania with my husband and our 3 daughters. Our oldest, Rebecca, is 23. Our middle child, Madeline, is 19. And our youngest, Sydney, is 9. So we're busy, we're running. We stay active.
And your husband's name?
My husband's name is Charlie.
Charlie, all right. So we got Charlie, Rebecca, Madeline, and Sydney.
Correct.
All right. Let's talk about your history with PKD when you were first diagnosed. How were you diagnosed and how did that come about?
Sure. So I'm hearing, I get all this information secondhand because, I was quite young and really, I think at the time, probably unaware of what was happening, why I was being checked, why I was having an ultrasound done. I knew what was going on with my dad, but, at that point in my life wasn't really connecting, oh, this is a hereditary disease. My siblings and I might have this. So it was much later on that my parents sat me down when I was around 18 to talk to me about that. And I'm grateful for that because at 10 years old, what can you really do, when there's no challenges, there's no side effects, no symptoms. So just kind of knowing the history, my parents said, hey, let's just get an ultrasound, see what's going on here. And sure enough, already had cysts at that age.
Wow. Would it be fair then to say that PKD runs in your family?
Yes. So my dad, his mother actually was passed away in her around my age, 43, 44, passed away from then an unknown disease. They didn't know exactly what it was at that time. In fact, I think they misdiagnosed her with Bright's disease. And so then she wasn't treated appropriately because she actually had PKD. So she passed away quite young, 43, 44. My dad's end-stage renal disease began around 40 for him. He spent 18 months on the transplant list and on dialysis, and then had his transplant and had that around 43 years of age. I'm 44 now, and stage 4, EGFR of 25 on any given day, sometimes a little better, and pre-dialysis. So I'm counting myself very, very blessed and fortunate that, my progression has stayed a little bit ahead of the curve, so to speak.
Okay. 2 of your siblings also have PKD, is that correct?
Yes, that is correct.
And their names, please?
Curtis and Chelsea, and they are both also pre-transplant, pre-dialysis. I'm not sure exactly what stage they're in. I think I'm probably the furthest advanced of all of us, and I'm the oldest. They are both younger than me. So the interesting kind of stat there is that PKD has a 50-50 chance, if it's autosomal dominant, of being passed from one parent to a child. And all three of my siblings, like myself and my two siblings, all three of us have it. So there's some crazy math going on right there.
Okay. Let's talk a little bit about your father, Conrad. It's my understanding that he had PKD. He was on dialysis. He was transplanted. Can you tell us a little bit about that?
Yeah, absolutely. So this is back in the mid 80s. He, went into end-stage renal disease, started dialysis, and still wanted to really be a working, provider. And so this is well before home hemodialysis was kind of, a popular option for people, or an option at all. And I don't really know the story about how it came about, but I will tell you that my mother, who is not a nurse, was trained by dialysis nurses to give him home hemodialysis in our home. We installed the machine, we installed plumbing, all the things that were needed so that he could do dialysis at night after working 3 times a week. So we literally saw that happening in our home as kids.
Okay.
18 months on the list and on dialysis. And then they got the call, perfect matching kidney. And away they went to Pittsburgh, 45 minutes away from where we lived in Wheeling, to Allegheny General Hospital, where his transplant took place.
In 1987, correct?
And around that time, yes.
Okay. Your dad still faced challenges in his life with his kidney issues. Can you talk to us a little bit about that?
Yes. So the interesting thing about, I think, kidney disease, or PKD in general, is it's not a disease that you are not familiar with. It's usually one you have watched a loved one deal with. And so we watched our dad, I think in the beginning, really struggle adjusting to all the medication, all the immunosuppressant medication that he needed to take, steroids, you name it. Anyone that's had a transplant can probably, relate to that. Adjusting to all that, adjusting to new dietary, restrictions, things like that. And I think over time, if I understand everything correctly, immunosuppressant drugs do help you keep your kidney, but they do also cause a lot of other challenges. So he had multiple situations where he had to have skin cancer cut out. And of course, they do that in the office where it's not a clean environment. And then he would get an infection and he'd have sepsis. And he had that 5 times. And so each time he would be hospitalized for weeks and then have to go to rehab for weeks. He had other challenges not related to PKD. He broke a hip, he broke a femur, he had knee replacements. I think all of that is to say that we were very aware of our dad's tenuous state of health from moment to moment.
Okay. My notes are showing that he had close calls with kidney rejections, that he had sepsis 5 times, that he had different types of cancer.
Correct.
Are my notes correct?
Yes. Yeah. He had skin cancer off and on, pancreatic, or not pancreatic. Why can't I say what the word is? He had just a couple different types of cancer. And then toward the end of his life, had another different kind of cancer, had treatment for that. And it was around that time that either the treatment for that cancer caused the kidney to fail, or it just failed. And so he had to go back on dialysis before he passed away.
Okay. One of our listeners, my friend Candy Gagney, is asking a question. Have you ever considered preemptive kidney transplant?
Absolutely. And you're the one that has helped encourage me to bring that up at my doctor's appointments. And so the last 2 visits, it's been a topic of a conversation.
Oh, excellent. Excellent.
Yep.
Talk to us a little bit, the things that went on with your dad. Please describe for us the effects his experiences with PKD have had on you and your handling of PKD, and in particular, your kidney advocacy.
Yeah. Well, like I was saying before, I feel like having PKD as an adult doesn't mean that you have a disease you don't know how it's going to affect you. It's not like a diagnosis of cancer if you're unfamiliar with cancer. It's a disease you really watch someone struggle with. And so you kind of live your adult life knowing at some point this is going to be kind of happening to me. Maybe it'll look a little different, but it's going to happen. I think that in some way that brewed in the back of my mind through my younger adult years that, hey, your future may be a little less uncertain. Look at what happened to your dad, that could happen to you. So that was kind of my mental, like my self-talk about the disease. I wasn't afraid. My parents did not teach us to be afraid of it. In fact, my mother would say, this isn't a death sentence, but it is something, we want you to take seriously. And they were the best examples to me of just strength and being willing to speak up. Like, for my dad to have home hemodialysis in the early 80s, that when I tell people that, they don't believe it. And I have the pictures to prove that it happened, but they spoke up and they said, hey, this is what will work for us, and, help us make this happen. So watching that, even though I didn't know it was happening, I think that turned me into a little advocate from a young age. And it made me realize that I didn't have to do everything everyone told me to do without question. And that included doctors. So when it was time to see a nephrologist for the first time, I had a list of questions. And when they prescribed medication, I had questions about that, or if they wanted me to get a test, tell me about that. I think that's the biggest piece of advice I can give to patients is form that good relationship with your provider. Show them that you're engaged in the process. Show them that you're engaged in your own care. And I think they begin to treat you a little bit differently. I feel like I have an incredibly engaged nephrologist. She knows I'm an above average patient, as far as my education level. And some of that is because I have to be, not every nephrologist is a PKD expert, right? So I do my best to make sure I'm informed and I have, information at the ready.
Okay. I want to talk to you about a first for our broadcast that we haven't discussed before. I read an article about you concerning pregnancy with PKD, what you should know. Can you talk to us about you and your experiences with PKD and your pregnancies?
Sure. So I have 3 children and I've been pregnant 3 times. I was not really thinking about PKD and my pregnancy during my first. It wasn't until I was regularly seeing a doctor and they said, hey, your family history, your PKD. Of course, they just say family history because they don't, OBGYN doesn't know a lot about PKD. They just know there is a challenge here and blood pressure control is already an issue for women that are healthy and have a pregnancy. So they knew kind of going in kind of early on, this could be a challenge. So not only did they ramp up diagnostic imaging to make sure that my baby didn't already have cysts on her kidneys while I was still carrying her, but also to make sure they watched me to watch my own kidneys, to watch my blood pressure. I was watched like a hawk. I had way more appointments than I think the average, healthy person, because they want to check your blood pressure, so often. So that was number one. I had to have her early because of high blood pressure. Number two, kind of a similar situation. At that time, I wasn't even seeing a nephrologist because while I wasn't pregnant, I didn't have any, effects of the PKD yet. My blood pressure was normal when I was not pregnant. So it was sometime around 30 that I, went to the general practitioner. Just did not feel right. Just things were just not great. Headaches, just blurry vision, spots in my vision, things like that. And here my blood pressure was just off the charts. And they're like, well, you got to go. It's time to go see a nephrologist. It's time to, get on a medication. We'll put you on something just until you get to talk to that nephrologist. Get yourself a blood pressure cuff, start checking, start recording, all the stuff. So then I had my third child when I was 34. So I had already been seeing a nephrologist then for those 4 years in between being 30 and 34, was on a medication, planned my pregnancy then because I was on a medication with a black box warning for pregnancy. And that's very important for anyone that takes a medication that could possibly ever be pregnant. To be very careful about interactions for a baby when it's very, very newly developing. So I planned the pregnancy. I planned to get off that medication and switch to something safe for my pregnancy with my nephrologist in concert with maternal fetal medicine. And I had the best pregnancy of all three, I believe, because my blood pressure was controlled and I felt the best, had the best outcomes. Still had to deliver early, but everyone safe and sound, beautiful and healthy.
Beautiful. Let's drill down a little bit on the medication issue, because I'm sure there are moms out there that would be concerned about that. Yeah. It's my understanding that you were taking Nifedipine, Nifedipine, before the third child, before conception. Is that correct?
Nifedipine and lisinopril. And yes, and you cannot take lisinopril for sure during the early parts of a pregnancy. So they get you off of that, and if you're planning it. Okay.
During your pregnancy, you were taking labetalol. Did I pronounce that right? Labatall?
Labetalol. Yep.
Almost.
Yeah. Yeah. That's a very common drug used during pregnancy and nursing.
Okay. One of the things we're going to talk about a little bit later is your experiences with Talvaptin. It's my understanding, no Talvaptin during the pregnancy.
Correct. Yes. It's not indicated for pregnancy or breastfeeding.
All right. Talk to us a little bit about PKD risks during pregnancy. It's my understanding 80% of PKD pregnancies are problem 3, but then there's that other 20%. So can you tell us a little bit about that?
Yeah. So again, I think because blood pressure is already, and this is I'm not a physician, but my understanding is, when you're carrying a child, there's so much extra in your body, just everything, extra weight, extra fluid, extra hormones. And then of course the baby is in there and it's near your kidneys. And of course my kidneys are 21 and 19 centimeters respectively. So, a normal kidney is supposed to be 8 or 9 centimeters. So you add a baby in there and suddenly, there's a lot going on in our abdomens. So there's a lot of pressure put on the kidneys. Also, the kidneys already do so much work to filter our blood and provide vitamins that are vital back to our bodies. Your body is already working so hard to do that just to, keep up with its own needs, but then it has the needs of your child. So I think just that strain on the body can be very traumatic. In fact, I was chatting with some other PKD mamas just today about how much do we think our pregnancy has changed the course of our disease? And, I'll say, I don't know exactly my brother's numbers, but we're very close in age. And, with my progression being where it is, the only difference between the two of us, besides 21 months of age, is I've had 3 kids. So, I think it stands to reason that it is hard on the body, and it can. Now, that said, my numbers took a dip after having my 3rd child, but they did rebound a bit. So, numbers don't tell the whole story, and they aren't the end. So I encourage people not to get freaked out when they just have a baby, because there's still a lot going on. It takes months for, your body to kind of normalize, between hormones and fluid level and getting on the right meds, et cetera. So yeah, I think I said, like I said, blood pressure plays the biggest part. And of course, preeclampsia is the biggest risk then to any pregnant mom, who has uncontrolled blood pressure. And, obviously the kidneys can, spill protein. And then that's a sign of, an even bigger challenge. So, and that's why a lot of moms end up needing to be delivered early, due to preeclampsia, or kind of, I never was diagnosed with that, but I was definitely on the way there with number 1. So, you don't even have to have a kidney disease to be at risk for that, but having kidney disease just takes that risk up higher.
Okay. Talk to us a little bit about your experiencing with monitoring during your pregnancy, both of yourself and of the child.
Yes. So, like I said, in my first, that's when they were like, hey, we normally would only see you once a month at this point. Well, we're going to want to see you every week. and there were times where I wouldn't be able to leave the doctor's office because they're like, hey, we need you to lay on your left side, and we needed to check your blood pressure again before you go anywhere. That's kind of alarming when you're a brand new mom, and you don't know what's going on, what to expect. By the time you're on to your 2nd or 3rd one, you kind of know this is par for the course. I have a blood pressure cuff at home, and I keep track of my blood pressure, report that to my OBGYN and my maternal fetal medicine doctor. With my 3rd child, of course, now we're talking 13 years or so in between my oldest and my youngest. So a lot of things changed for the better. But that was how that introduced the ability to have 3D ultrasound. So that just brought a whole new level to the experience. So I think just extra blood pressure monitoring, being on the right medication for pregnancy that's safe, and I've said this in an NKF podcast, how important maternal fetal medicine is. It's not something for everyone. It's when you have additional health challenges, you're at advanced maternal age, things like that. And that's just basically a pregnancy specialist that comes in and kind of lays over top of your OBGYN, your other specialist, in my case, a nephrologist, and then that maternal fetal medicine doctor. And they work together to make sure that they're taking care of the baby, the mama, making sure everyone has good outcomes.
Okay. And just so everybody knows, the links to that particular podcast are in the comments to this broadcast. So if you want to know more, you can find them there. Your Uncle Jim's trying to take care of you, So talk to us a little bit. And this is very common with PKD patients, both mother and father, about passing along PKD to your children. You have one parent that has PKD, you have one normal parent, 50% chance that you're going to pass this along. Tell us a little bit about what that feels like, what your concerns are.
Yeah. So it's interesting. Again, not something I thought a ton about with my first pregnancy, because it's still, that child is kind of a concept, right? Still, before they're out in the world and they're, talking back, I don't think you're thinking about that. At least I wasn't at that time. I kept hearing the reminder of my mom, this isn't a death sentence. And an anecdote that I think of often is when my dad was kind of newer diagnosed and we were younger. they were seeking a second opinion. And that second opinion was the person who said, someday you're going to take a pill for this. And so I know we're going to talk about Talvaptin later, but I think it's interesting that that day came and now I take a pill for this. Now it's not a cure, but it's a step in the right direction. But I think guilt is a common feeling among PKD parents. And that's something that we can identify with each other about. Some people with PKD choose not to have children, not to have their own children. They choose to adopt. Some people choose to go through a process by which they can ensure that their embryo does not carry the PKD gene. Those kinds of things we just weren't talking about 23 years ago when I had my first children. I know my dad dealt with that guilt. I know he felt it. I know that it was sometimes difficult for us to talk about PKD between the two of us. And I know that was because he felt horrible that he had passed this on to us. And I think, this is one of the things that fuels me now, is because I don't want that to be the way I feel. And I know that's not what he would want for me. I know he would not want me to feel guilty about this. This is what it is. I think instead I can show my kids, hey, this is what mom's doing. In fact, my kids are witnessing this tonight, and they see me on webinars, and they see me, accepting an award at the NKF, and coming along to watch that. So they see that, whereas I saw dialysis happening in my home, dad going into the hospital for treatment, things like that. Our experiences are quite different, and it's only a generation of change. My oldest daughter was diagnosed last March around her 22nd birthday. So I do know that I have at least one kid with PKD. The other two we haven't found out about yet. There's no need right now. But I just think, can I show them that there's a different way? There's a different way to take this challenge and harness it and turn it into something really good. And, I think we were chatting earlier, the way I've started to look at this is I've met amazing people, and I've had amazing opportunities and experiences because I have PKD. The speaking engagements I've had, those are all because I have a disease. They're not for any other reason. I love being a public speaker, but I don't really have a platform besides this. And so in a small way, I'm, kind of like, it's hard to be too upset about it when so much good can come out of it if you choose to look at it that way.
Okay. During your pregnancy, I know that you were monitoring your children for PKD. One of the interesting decisions I thought that you made was a decision concerning genetic testing. Mm-hmm. Can you talk to us about that a little bit? Why you made that decision?
Sure. So as any mom knows, they will offer you, testing at a specific week in your pregnancy to find out, to pull DNA and to kind of find out, are there challenges? I think mostly they are looking for specific DNA challenges that are known. I don't think they're necessarily looking for PKD at this point. But I've turned it down 3 times. Their answer wouldn't have made any difference to me. It was always going to be my decision to carry each of my children and give them the best life I could possibly give them, no matter what that test would tell me. So that was just a personal feeling of mine, just based on my beliefs that I would not need that information. So easy choice.
Okay. Cari, like me, you have an extensive history of PKD in your family. How do you discuss this matter with your 3 daughters?
Yeah. So, I mean, there came a time where I kind of pulled the older 2 aside and said, and it was kind of around the time where I was ramping up the clinical trial. And I knew that the difference that made in my life at that time was that PKD was now going to be a part of daily discussions. And that is something when you begin taking a medication like Talvaptin, it's something that's now on your mind kind of twice a day versus just quarterly when you go to see your nephrologist or when you go to have your lab work done. It's something that you think about every time you pop that pill. Now, 6 years in, I'm not thinking about that every time. But initially I was, of course I had a lot of hope tied up in that little pill. But I've told them, hey, this is a possibility for you. And when you're ready to find out if it is or not for you, I will support you. If you don't want to find out right now, no problem. I kind of want them to feel like it's their choice and not something that I'm forcing on them. And I think, they both have decided, differently how they want to handle that. And again, I think everybody needs different levels of information, right? Some of us have got to know, what's going on in there. Even if I can't tell anything's going on, I got to know. And some people are okay not knowing that until there's a need to know. So I just, again, try to be the best example. I take care of myself. I'm active. I work out. I am hydrated. I try to make good choices with, food, beverages, things like that. So I just try to lead by example in that way.
Okay. You've talked to us about testing and making a decision as to when to test your children. When I was diagnosed, when I came along, they talked about testing around the age of 30. Mm-hmm. I'm wondering, with your children now, at what age would you recommend considering testing for polycystic kidney disease?
Yeah, my oldest, we were letting her decide. Unfortunately, she was having kind of some headaches and other things going on. I was like, just, go see the general practitioner. And as soon as you say, I've got this family history, they're going to say, we probably should test you. For my other 2, I think I'm not in a hurry to find anything out as long as everything is good. Blood pressure is normal. They're not having any sort of other symptoms. But I think 30 is probably a bit too late. I was 30 when I realized my blood pressure is out of control. I need to start seeing a nephrologist. And if I knew then what I know now, I believe I would have probably made these life choices I was just talking about. I would have started that way earlier in my life. Because even if there's not conclusive proof right now that maybe going vegetarian or vegan or all the different ways you can try to suppress, the progression of PKD. There's lots of different thoughts out there about that right now. I could have tried any of those things a lot sooner in my life than, where I'm at now. So I don't think there's anything wrong with just still living a healthy life, being a hydrated person. It can hurt even if there's no PKD.
Okay. Let's talk about your own course of treatment with PKD. When did the progression of PKD begin to show up in your blood pressure checks with your general physician?
Yeah, I was around 30. I think I was, experiencing just chronic headaches. Like I said, spots in my vision, things that I think when I researched them, and at the time, all I had was WebMD, because we're talking, 14 years ago. I knew hey, it's just time to talk to somebody. And, of course, mentioned the family history to my doctor. Again, I think knowing what my dad went through, I knew to mention my family history. Whereas I know a lot of people, unfortunately, either crash into dialysis or show up to a doctor with no knowledge of their PKD and find out they're already in stage 3 or 4. And that's why I say age 30 is probably a bit too late to be tested because, we all progress differently. There are 2 types of PKD, one that progresses much faster than the other. And, there's no way to know which one you have until you have that testing done. And so, yeah, I don't know. I think
the dominant version, the recessive.
The fast progressing versus the slow progressing, PKD 1 versus 2. So I have the fast progressing, but hey, we're all different. And, so I don't know. I think 18 to 20, like when you're an adult and you're ready to process that information like an adult, and take matters into your own hands, I think is a good time.
Okay. You were seeing a nephrologist. He was doing labs. She was doing labs,
Yeah.
Blood pressure checks, trying to lower your phosphorus, raise your vitamin D, sort of a reactive approach. Why didn't that work for you? What was there about that didn't sit well with you?
Well, to me, it just seemed very passive. I say reactive, meaning it was a situation where, I'll look at your lab numbers and then I'll tell you what to do next. So it was more like waiting for something to happen and then responding to it versus saying, why don't we try this as a way to prevent the following things that may happen to you: high phosphorus, low vitamin D, etc. And I only say that because while that may seem small, that I knew that eventually we'd be talking about much bigger decisions, like when to go on dialysis and when to get a kidney transplant. And what I didn't know at the time was that I'd meet others who would advocate for preemptive transplant. So what my 30-year-old self didn't know was that those things would come into my life and I would learn about those options. I didn't want the option to be, well, you'll just go on dialysis when your kidneys fail and then we'll find you a transplant, and that could take 8 years or so, depending on where you live. So that kind of wait and see approach just didn't sit well with me.
Okay. I know you did some independent research. You discovered a clinical trial, the Reprise trial. Can you tell us how you got involved with that and what happened?
Yeah. So, and again, this is like me leaving the nephrologist feeling kind of like there's nothing to do except go home for 6 months to a year and not do anything. Just wait while things happen in my body that I can't see, and I won't know what's happening in there, what's happening, how my progression is going until I get those next labs. And I was at the stage in my progression where I think I was seeing a nephrologist once a year. Of course, I'm seeing her much more now, but that's how nephrologists will handle you: once a year, every 6 months, every 3 months. So it was in that yearly cycle time where I was like, there has to be something else, like this sitting and waiting for the thing that I know that's inevitable to happen. This is just, I can't do this. So I started just a Google search, PKD treatment, found clinicaltrials.gov, found that Talvaptin was in a trial phase, found out where it was happening through that clinicaltrials.gov link, found out that the University of Pennsylvania in Philadelphia was conducting the trial, or they were a trial site, found out who the trial coordinator was, found her on LinkedIn, started to message with her, and had a phone call. And she said, asked me a bunch of questions. And of course, one of the first questions is are you pregnant or nursing? And I was nursing at the time. And it was my goal to nurse my youngest child for 12 months, as I had nursed the other 2 for 12 months. So I said, hey, I want to finish doing this, but if something changes with the trial, if another trial opens up, please let me know. So we connected, we stayed in touch. And it was a couple of years later that she reached out and she said, hey, you'll never believe this. That first trial that we talked about, not enough people completed it. So we have to open another phase. Same drug. We have to open another phase of this trial. And, you're able to get into it. And I was the second to last person in the country to enter the last phase of the Talvaptin trial.
And this was in January of 2016?
Yeah.
Approximately?
Right. Yes.
Okay. Now, I want people to understand something about my friend Cari's determination to act proactively. Let's talk a little bit about the challenges you had traveling back and forth to the center in Philadelphia.
Yes.
How far away? How many trips? What kind of mileage are we talking about?
Yeah. So it's about 2 hours with traffic. It's about 90 miles one way from either my office where I would go or from my home, depending on what day of the week it was. Mostly it was from my office. My employer was amazing. They let me take half days off. I made all my appointments at like 2:30. So I'd leave the office at 12, get down there around 2. But yeah, so two hours of driving, an hour maybe in the hospital, 2 hours of driving home, 30 times. So I'm fortunate that I had a good working car. I could afford the time off of work. I could flex my time. A good employer that was willing to support me in wanting to do that. Not everybody is that fortunate, and I am absolutely aware that is a barrier to people, being able to participate. But I had the opportunity, and there was literally nothing that was going to stand in my way, not even snow. I drove in the snow, and those visits became very life-giving to me because there came a point where I realized this has momentum. People are excited about this. If this gets approved, it will be the first ever treatment for PKD. And so it was kind of one of those like things where you feel like, the grassroots advocacy type of thing, where you feel like we're doing something special here and it's amazing to be a part of. And I knew too, one day one of my children may need to benefit from this drug. So I was very invested on many levels.
Okay. The one thing that surprised me that I found in my notes was you knew right away you didn't get the placebo. You knew you got the real thing.
Yes.
Can you explain how?
Yes. So Talvaptin is what's called an aquaretic. So there are drugs that a lot of people are familiar with called a diuretic. This is very similar in that it causes you to go to the bathroom quite often and to drink a lot. So, I drink 3 to 4 liters of water a day. On average, in the summer, it's much more. I have been on diuretics. I was on hydrochlorothiazide at one point very early on when I was recovering from my first pregnancy. I knew without getting into details what it was like to be on a diuretic. And as soon as I took that first dose, within a half an hour, I knew I was on one. Now, no one could ever confirm that with me because it was a double-blind trial. But of course, in the end, I did have that confirmed that I was on live medication. So, but that just made it even more interesting because 2-hour car trips were not fun. But over time, my body has really adjusted to the medication, and that's the advice that I give to people that are looking into the medication: is that your body adjusts.
Okay, my notes again: 4 hours round trip, total 31 visits, 5,500 total miles, and 124 hours of just driving back and forth to the clinical trial.
Yeah.
You're one determined individual.
Well, you also didn't add up all the times I had to get stuck and give my blood and, all the other things. So, honestly, the driving was the easy part. I made it fun. I was going to Philadelphia. They obviously have things that we don't have out here in Lancaster County. So I made the most of it. Let's get a little shopping done while we're in Philadelphia, see some sights, So it really was enjoyable. it was that like kind of alone time in the car that we don't always get when we have, kids at home and stuff. So, yeah, I'm thinking back now and certainly listening to it getting added up like that, I never would have thought of that like that, but, yeah, totally worth it. Totally worth it.
Okay. And just so everybody knows, you're still on Talvaptin this day. It's had a very positive effect for you.
That's correct. It's called Genarq in the United States. But yes, it's the same medication, and I'm on the same dose I was on in the trial. And my nephrologist considers it to be doing something. The difficult challenge is there's this X factor, right? We don't have a timeline of how everyone's PKD is going to progress. We don't know at what age or date certain events are going to happen. We only know that there are life events that take a toll on people, that there's a critical mass that is reached, and at that point kind of things can drop off drastically, or they can slowly kind of climb downhill. So we don't know which we're going to be, and we don't know those dates. So that's kind of the interesting part about being on the medicine, is that we don't know how much it's helping us particularly. We just know the data that came out of all the years of the trials, that in general, it does extend the life of kidneys by an average of 5 years.
Okay. One of the recurring themes that I see in a lot of the materials that you've written, or the interviews that you've given, or people have written about you, is that as a result of your experiences, you feel clinical trials should be more inclusive, and that the patient's voice should be front and center in the development of clinical outcome assessments. Can you please talk to us about that a little bit?
Absolutely. As I was saying earlier, I had the ability, I had the time off of work, I had the time to drive a car that would get me there, gas to put in my tank, you just name it. Think of all the challenges that could be roadblocks that seem easy to some of us, but they're not for everyone. And so the fact that that trial site was in Philadelphia versus Lancaster, where somebody that lives down the street from me could take a bus, public transportation, wouldn't have to take 5 hours out of their day, miss work, et cetera, to be a part of those are the things that I, feel passionate about. Additionally, there's so much secrecy around a trial, and for good reason, and I understand it. But when you're on a medication that, you only, maybe 1,300 people in the whole world are on, it kind of feels a little isolating. I mean, you already have a disease that you don't know anybody else with, except your own family. And now you're on a medication that you're excited about, but you can't really talk to anybody about it. So I have talked openly about letting people sign waivers that allow them to connect with other people in a trial. And I've talked about that at the Bayer Finerenone Summit, about just creating a community where people can share just experiences, ideas. We're doing that now in the Talvaptin and the Genarq community, because it's approved and it's out there. And there are some wonderful Facebook groups that people get together and ask questions of people that have been taking it for a long time. How do you do XYZ? How do you manage car trips? How do you manage flying? Things like that. And so those kinds of things that are just part of your day-to-day life, you don't realize until you're taking it, and then you have to kind of hack it yourself. It's much better when we're together and we can help each other out.
Okay. Talk to me a little bit about your current kidney health. How has the medication benefited you?
And again, that's the kind of the X factor. I think it has slowed my progression. There's no way to know. Would I already be in end-stage renal disease by this point in my life? My dad was. He was already 3 years post-transplant by the time he was 44. So, and my grandmother passed away at this age. So I count myself, kind of ahead of the game there. like I said, I'm well hydrated because of that medication. I know that helps other areas of my health. And again, I'm taking a pill every day. It's reminding me, hey, I've got this thing, make good choices. But my nephrologist is happy. My numbers are pretty stable. They're declining. I won't sugarcoat it. A 25 GFR means I have about 25% of my function left. So, it's absolutely declining, but it's kind of, one number a quarter, two numbers a quarter. It's pretty slow, pretty steady. And, I'm happy with that. If it gets me a little bit older before I have to have a transplant, hopefully that means I only have to have one in my lifetime. And that's the goal of taking the medication.
Okay. Let's talk about your kidney advocacy experience. I understand that you're a member of the National Kidney Foundation's Advocacy Committee. Can you talk about your experiences with the NKF?
Absolutely. So it's interesting. I was seeing photos of people going to Capitol Hill and talking to congressmen and senators about kidney issues and kidney patient rights and needs. And that kind of lit a fire under me. Like, there's a group of people that do this. I mean, The West Wing is like my favorite show of all time. Like, I could go be and do that, as a volunteer. And I was working for a company that was giving 40 hours a year of volunteer time away, which is fantastic. So I, immediately reached out to the NKF, got involved, have been to Capitol Hill in person as well as virtually the last couple of years. And then from there, it has really, really taken off. I feel like once you do something, they're like, you're the expert in this. We're going to tap you on the shoulder for these other things. So I've talked a lot about PKD, pregnancy, clinical trials, all the things I just have life experience with. I currently am serving on their patient network, advocacy group, and steering committee. And so that allows me to bring what I do professionally, which is work in the tech world. So we talk about, the user experience. We talk about data flows, email delivery, all the things I've, had professional experience with. We talk about that in the context of this patient network. And and that led me to the PKD Foundation and their patient network. So kind of, once you're kind of in the system, you kind of get, shared with other teams. And that's kind of how I branched out into PKD Foundation.
Themes that I see over and over again in your advocacy: patient education, early detection and treatment, scientific advancement through patient-oriented research, patients taking a more active role in their health and becoming stronger advocates for themselves, what us old school guys would call being your own best advocate. Can you talk to us a little bit about why you feel so strongly about these things?
Yeah, I think, again, it's because I had that modeled for me as a child. And when I was too young to even know that that's what was happening. But now as I look back, I think, yeah, I watched my parents do that. I watched them advocate for themselves. I watched my dad advocate for himself, and I watched my mom advocate for him with doctors and nurses. And I think that just, again, that was the best example someone like me could have ever gotten. And I think, as I think about going into the doctor for anything, it's a lot more of an easy experience when you feel armed with information. Going in blind, like, I don't want that to be my story. I want to go in with information. I want to be able to ask questions in the moment. And I want to feel involved in my own care. I don't want to be like the patient. I kind of want to be like the most important person on the care team. And I know that there'll be a time when I need a transplant or other interventions that, my voice might not be the loudest in the room. Like, I might not be able to be that voice. And so I want to show other people what that's like.
Keep talking about preemptive transplant. You need to get hooked up on that. Let me know.
Yep.
Let's talk about what happened in March of this year with the NKF at their clinicals. You were awarded the Celeste Lee Castillo Patient Engagement Award. This is the highest honor that the NKF gives to their kidney advocates. Tell us what's that like?
Well, Jim, it's incredible. I have when I got that email, I still kind of feel like, was that real? Did that really happen? I knew that Curtis, my good friend, Curtis Warfield, had won it in the year past. And my first thought was, they think I'm like Curtis. Like they think I'm as good as Curtis. We all have that kind of person or people that, we see that they have blazed a trail ahead of us and they have been examples. And you and Curtis and Mary, you have all done that for me. Have taught me kind of the way to go, what to do, how to say things, what to say, what to share, especially, when it comes to legislative issues like we were talking about before we hopped on. So really just a big shock. Did not think I would ever get something like that. But what a tremendous honor. And I hope that it has just kind of brought, attention to what I'm doing, why I'm doing it. If that has happened, then, that was a good outcome for me. But also just what a wonderful experience to be in the room with the other award winners in Boston and to, meet, all the wonderful NKF staff who have, made that award possible.
Okay. Just so my audience knows, my friend Cari is not a one-trick pony at all. Did advocacy work for the PKD Foundation, spoke at the 2021 PKD Regulatory Summit, talked at the PKD Outcomes Consortium at the Critical Paths Institute, was at the Bayer Pharmaceutical First Clinical Trial Patient Retention Summit, was quoted in the book, Broadly Engaged Team Science and Clinical and Transportational Research, very active on the new NKF PKD network, particularly on the issues of pregnancy and PKD. What we're all wondering, Cari, is advocacy-wise, what's next? What do you have going on in the future that you can talk to us about?
Wow, I wish I could tell you. I think there are things in my mind that I think about. I'm busy with work and I'm a busy mom right now. So I kind of am responding to people as they bring opportunities to me. I would definitely like to write more. In the future, maybe, a couple of pieces that I'll put out there at some point. I definitely want to document my transplant journey, and hope that helps someone else. I don't know. I just think, as opportunities arise, I'm always raising my hand when it makes sense for me. So, I have an open mind.
Okay. Is there anything else you would like to discuss before we close the conversation for the evening?
I just always like to close with a reminder, to patients out there and caregivers, to not be afraid to speak up. It doesn't have to be like this. It doesn't have to be like on Capitol Hill. It doesn't have to be webinars or speaking engagements, but it starts as something small in just telling a friend your story, sharing your experience. There's a lot of value in being open about the things you're going through and telling someone you trust about your story. Keeping it to yourself, I can't imagine how isolating that is. Having a chronic and progressive disease, it doesn't feel scary to me when I open up about it and I let people in and I let people know who I really am, and then helps people understand what I'm going through. It helps my kids understand I'm not 100% every day. It helps my work understand I'm not 100% every day. I just think that understanding is what we all want. We want to be known. We want to be seen as people. And so it's a little piece of ourselves that we can share with the world in hopes that somebody may one day say, I know somebody that has that. Let me connect you. And I've met the most wonderful people that are in my life because of conversations like that I've been willing to have, and I've been willing to be vulnerable. We're in a different world now where, when my parents were younger and I was younger, they said, don't tell anybody that you have PKD. You don't want that on your medical charts. You don't want, to be discriminated against in the workplace. You don't want to be discriminated against when it comes to life insurance. And we're on a much more level playing field now in our world with Affordable Care Act and other protections for patients. So I'm out there with it. I want people to know what's happening. And again, it's just connected to me to wonderful people like yourself, and helps me not feel quite as alone in having PKD.
Okay. Cari, what a wonderful conversation. I really appreciate you taking the time to come on and educate all of us and speak to us about these matters. Thank you so much for taking time to talk to us. Boy, lots of comments. Lots of comments. You have a family member named Kathy?
That's my mom. Hi, Mom.
Hi, Mom. She's saying, what a wonderfully strong and inspiring warrior. No kidding, Mom. So I greatly appreciate you taking to come on and talk to us tonight. And wow, what a lot of great ground that we covered. Thank you so much, Cari, for coming on to see us. So, any rate, folks, that's our show for tonight. Thank you for watching.
Thanks, everybody.
All right. Thank you, Cari. You have a good night.
You too, Jim. Thank you so much.
I appreciate it.
Bye-bye.
Bye-bye now.